You're watching The Mojo Story, our independent digital platform that does a deep dive into the big stories of the day. I'm Barkha Dutt. Welcome, everyone. Today, we're here to talk about Baba Ramdev, Patanjali, and the controversy around Coronil. These are pictures you would have seen when Coronil was launched in the presence of the Union Health Minister as well as another Union Minister, Nitin Gadkari. So far, so good, except if you take a look at the poster that was behind those ministers at that event. Those posters were claiming a certification from the World Health Organization that the WHO has since said has not been given. The WHO distancing has led Patanjali to clarify its own position, saying that the certification it received was from the Drug Controller General of India as well as the Ministry of Ayush. But the controversy has snowballed after the Indian Medical Association has targeted the Health Minister for being present at the event, an event at which later Baba Ramdev likened modern medicine to medical terrorism. Now, what do we make of this entire controversy? Does the absence of the World Health Organization certification in itself mean that you and I should not be consuming Coronil? And what about the presence of the two ministers at this event? Let's bring up our panel on the program today. We're joined on the program here by Dr. Jayalal, who's the president of the Indian Medical Association. We're also joined by another member of the Indian Medical Association, Dr. Rajeev Jayadevan, and we're joined by Dr. Parmeshwar Arora, who's of course a well-known Ayurvedic practitioner. Welcome everybody to the program. I'll start with you, if I may, Dr. Jayalal. Very, very strong words from the Indian Medical Association. It almost seems like a personal disagreement with Union Health Minister Harsh Vardhan. And I just want to read out some of the key points that your statement made, saying surprising that the Health Minister was found promoting Coronil. This is a statement from the Indian Medical Association. And the Indian Medical Association is saying that some of the claims that have been made by Patanjali are blatant lies and accusing the Health Minister of having disrespected the medical code of conduct. So these are very, very strong words that are coming from the Indian Medical Association that is taking on the Health Minister for being present at that release of the Coronil immunity booster. And the IMA is saying that it will seek a suo motu explanation for the Health Minister's conduct. So I just want to understand from you, Doctor, what led to this, Dr. Jayalal.
Yeah, thank you very much for this. And first of all, we want to clarify that we are not against the Ayurveda drug or we are not against any system of medicine. What exactly we wanted to say, Coronil is a trade name for an Ayurveda drug. By virtue of the medical code of ethics, any doctor who has registered, whether he is a minister or not, it's not a question, but he is as long as carry the degree and registration with the medical council, we cannot promote a trade drug in a public forum. Second, as per our medical code of ethics, you cannot promote a drug which is a secret drug. Secret drug in the sense, the propriety of the drug, composition of the drugs, then established the work of the drug is not well known and which a medical practitioner cannot promote. And when Honorable Health Minister himself is being in the mission and also in his personal tweet, even we are supporting that mission, that only we want to ask him because he is example and the first citizen of our modern medicine. And he should have shown the model to us. And when he himself is disobeying that, and that sends a shock wave into the medical fraternity, that is why not only as a minister, but also as a member of Indian Medical Association, and also the member of the Medical Council of India, we are seeking the explanation from him. I'm sure he will come out with an appropriate explanation in the right time.
So, Dr. Jayalal, I want to understand what you're saying. You're saying that the Indian Medical Association's criticism is not the absence of the World Health Organization certification, but that an individual drug was promoted by the Health Minister. You're drawing a distinction. Which one is it?
Why should we bother about WHO, which they himself has say that they are not given us? We are not going to the controversy whether it is a WHO certified or not because it has not done, because there is no point in talking on this. Our issue is why the health ministry is so interested to promote a particular brand of the drug in this way and say that it is a vaccine, it is a preventive aspect when the whole of India is now thriving on the vaccination drive. A signal when it comes like that from a minister, there is no need for a vaccine. In other words, he is saying that you take a Coronil, it itself is a prevention word.
So you are not at all interested in the part of the controversy where the World Health Organization, and let's please bring up the World Health Organization statement, The World Health Organization was in that poster behind at that event, right? And can we please bring up? I just want to show our audience what we're talking about. So World Health Organization. So 1 minute. It said has not reviewed or certified the effectiveness of any traditional medicine for the treatment. Acharya Balakrishnan of Patanjali later clarified that they had received the certification from the Ministry of Ayush and from the Drug Controller General of India. So you are saying on behalf of the IMA that you're not concerned with this WHO certification. You simply do not think the health minister should have been endorsing an individual product.
Yeah, that is what I want to say. Someone asked me that whether the sun is rising in the west. There is no point in arguing on that. I know for sure WHO cannot and will not give any drug for the clarification. Even in that poster, what they have posted is not, it is approved by the WHO. What they have put, it is a GMB certificate as suggested by the WHO. Even the COPP certificate, which you are giving, is as per the suggestion. And I don't think that it is, we need to go to the controversy of the WHO, whether it is certified or not. And we are not going to get carried away by that. We are going to carry it away with the ethical concept of this promoting a trained name by an ethical practitioner doctor.
Right. Let me bring in at this point Dr. Parmeshwar Arora and ask him what he thinks, because as I think you've heard from the IMA, Dr. Parmeshwar, this is not Ayurveda versus allopathy. That's something that Dr. Jayalal is making very clear. He's also saying he doesn't care about WHO certification or not. He's saying who is WHO to certify. So both of those things for the IMA are out of the way. He's basically saying a minister should not be endorsing any individual product. But by that standard, I'm assuming no minister can be at the launch event of any pharmaceutical company of any kind.
See, Barkha ji, आज जो scenario है for corona pandemic, it is different from the general, जो protocol होता है उससे बिल्कुल different है. आज हमारे प्राइम मिनिस्टर निकल करके कहते हैं कि आप कोविशील्ड लगाइए, कोवैक्सीन लगाइए. ये गवर्नमेंट के प्रोडक्ट्स तो है नहीं. डेफिनेटली ये प्राइवेट कंपनीज बना रही हैं वैक्सीनेशन, उसको हमारे प्राइम मिनिस्टर प्रमोट कर रहे हैं. सो Dr. Harsh Vardhan, not as a doctor, but as a health minister, is promoting Coronil as the precautionary medicine, Ayurvedic medicine, which can boost your immunity and can help you in preventing from the corona. And at the same time, he is also saying कि please go for vaccination also. So कहाँ दिक्कत है? अगर हमारे पास डबल शील्ड मिल सकती है, if we have double protection, तो उसमें दिक्कत क्या है? क्या कोरोनिल के इंग्रेडिएंट्स जिसमें गिलोय है, अश्वगंधा है, तुलसी है, कोई ऐसा सस्पिशियस चीज है जो हमें नुकसान पहुंचा दे? नंबर 2, क्या कहीं कोई क्वेश्चन मार्क है कि अश्वगंधा, गिलोय एंड तुलसी किसी भी वायरल इन्फेक्शन में, वायरल पेंडेमिक में हमें उपयोगी नहीं होगी? डेफिनेटली इट इज गोइंग टू बी वेरी हेल्पफुल. सो आई डोंट नो if you take allopathic medicine for something and by adding tulsi in your tea you get more benefits. So what is the harm? So what we are saying, our sole purpose is, Barkha ji, our sole purpose is to give maximum precaution to the society, not in India only but worldwide. So if we say that please go for vaccination, at the same time आप ये बताइए कि वैक्सीनेशन लगाने के बाद हमारे प्राइम मिनिस्टर क्यों बोल रहे हैं, मॉडर्न डॉक्टर क्यों नहीं बोल रहे कि आप बिल्कुल मास्क लगाते रहिए, आप सोशल डिस्टेंसिंग रखिए, फिर भी आपको सख्त रहना है, नियमों का पालन करना है. तो एट द सेम टाइम इफ वी से दैट प्लीज टेक केयर ऑफ योर इम्यूनिटी आल्सो, सो व्हाट इज हार्म?
Can I ask you something? ये जो Dr. Jayalal ने बात रखी, Dr. Jayalal just said that the point is not neither the WHO certification with the WHO denied, nor whether Tulsi is harmful or not. He is not saying Tulsi is harmful. He is saying that this is a commercial angle. There is commerce involved, and ministers should not be in. Ministers are breaking a code of conduct by promoting a commercial product. Well, how do you?
No.
How do you respond to this, Parmeshwar ji?
This is a different scenario where we have broken so many protocols. If we talk about the manufacturing of vaccine, then also we have broken so many protocols.
That's a fair question. That's a fair question, and I should actually put it to Dr. Jayalal, because that's a fair point that is being made at this point, Dr. Jayalal, by Dr. Parmeshwar, that when Oxford, AstraZeneca or Bharat Biotech's vaccines are promoted, and let's say tomorrow ministers or the Prime Minister went for their launch, the Prime Minister even went to Pune to the Serum Institute, you all didn't issue a statement saying this is promoting one corporate over the other. And since in this case you have chosen not to make your focus the WHO claim, which you could have, you're making the claim something else. how is the promotion, Parmeshwar says, of the vaccine any different?
Absolutely. See, that is for the public sector. The government has bought this medicine from the public sector. It is not for the sale. It is not going to the market and sale. If it is going to the market and the Prime Minister say that drug you go to the market and buy it, definitely it is a breach of ethics. But as a doctor, I cannot
I think
say
Parmeshwar, I think Mr. Parmeshwar
sold in the market.
Sorry,
अभी थोड़े
Dr.
दिन बाद ये
Parmeshwar.
बिकेगी, थोड़े दिन
no,
बाद
it is not
बिकेगी.
in the market, sir. Now it is in the public sector. It is why given free of cost by the government of India. That's a great gesture of this government of India. They are giving free of cost. They are saying that this drug we are purchasing and giving for free of cost. They are not for the individual companies' market benefit. It is not promoted.
Dr. Parmeshwar, and then I'll go to Rajiv after that. Parmeshwar ji, boliye.
मैं केवल इतना कहना चाहता हूं कि देयर विल बी ग्रेट काइंडनेस फ्रॉम द साइड ऑफ गवर्नमेंट ऑफ इंडिया इफ दे आल्सो परचेज द कोरोनिल टैबलेट एंड डिस्ट्रीब्यूट इन द मार्केट. If they can buy product from some modern company, why not from the Ayurvedic company? I will suggest the government should be kind enough to buy the Coronil in bulk and it must be distributed to the society.
Okay. I want to understand the issues here and let me put that to Rajiv. Rajiv, do you think that the focus should have been on the false sort of claim of the WHO certification, which since has been clarified by Patanjali saying that we actually received our certification from Ministry of Ayush and it was based on the system that World Health Organization follows? Because by focusing on the commercial dimension, is the Indian Medical Association weakening its case? Rajiv.
Well, as far as this situation goes, the way I see it is quite different from what Dr. Jayalal and Dr. Arora has said. I'm a scientist. Okay. I look at evidence and I look at all the papers that come from all around the world on the pandemic, even before the pandemic started. Now, when I heard about a product being launched in India, that is supposed to help in the pandemic. So I was quite interested to see what the data behind it was. See, if you, for example, we use dexamethasone, which is a steroid in severe case of COVID. The UK government came out and said dexamethasone is going to will be helpful after studying 6,000 people in a very strictly controlled, randomized controlled trial that showed proven, conclusive, irrefutable benefit. That was acknowledged even immediately by the WHO. Now, the vaccines we get are the results of very rigidly controlled trials on tens of thousands of people in phase 3 and hundreds of thousands of people in phase 4 trials. So we are standing on the shoulders of giants, if you will. We have like today I got my vaccination shot, my second shot. I didn't even blink an eyelid because I know that I'm standing on the experience of millions of people who have received the vaccine, and we have data that it is helpful. So with that background, I'll approach this question. Whenever a product, whatever genre it can come from, I don't really care what genre it comes from. It can be from modern medicine or any other branch of medicine. But we are in a pandemic. Obviously, we are looking for solutions, and we want clinical research. I was very happy that good research happened in India and they conducted a randomized controlled trial. I was very happy to read that. So as I started reading the paper, I found that the number of people included was disappointingly small, only 45 people. Now, where does 45 stand in comparison with 6,000 people that the UK government studied?
So you're saying your take on this controversy is what, Rajiv?
My take is there is no evidence. You can't call it scientific evidence. It's an
immunity booster, not a treatment for corona, right?
Yeah, because I read the word evidence-based medicine. There is no evidence that shows that it works with COVID-19. So I'm an evidence-based person. So all of my work is based on evidence, and including modern medicine, I've criticized all the work that's been non-evidence based, including all the medicines that are not being given.
I think that's a fair question, right, Parmeshwar ji? कि evidence based claim नहीं की गई होती. अगर सिर्फ बोला होता आप हल्दी खाइए, तुलसी पीजिए, चाय में गर्म पानी पीजिए, गर्म पानी में नींबू डालिए, that is a different thing. But because there's a certain evidence based certification, that is why the controversy.
See, Barkha ji, consuming dexamethasone steroid and consuming tulsi, giloy and ashwagandha, they are absolutely, जैसे धरती और आसमान को हम मुकाबला कराने लगे, ऐसी बात हो जाएगी. Doctor says that they have tried on 6,000 patients. I say giloy, ashwagandha and tulsi has been tried for maybe hundreds of million patients and for not for years, for 4,000 years. आज ये बताइए कि आपका गला खराब होता है, आप अदरक की चाय पीते हैं अपने घर में. You show me the scientific study which was certified by WHO or the European Union that अदरक की चाय पीने से गला ठीक होता है. You show me any study. और ये बताइए कि पूरे इंडिया में इसका इस्तेमाल हो रहा है कि नहीं हो रहा है. एक्चुअली व्हाट इज हैपनिंग, हम अपनी चीजों को भी, जो हमारी ट्रेडिशनल पहले से टेस्टेड चीजें हैं, देयर आर टू टाइप्स ऑफ थिंग्स. वन इज प्रोप्राइटरी एंड सेकंड इज क्लासिकल. क्लासिकल थिंग्स वी से टू देम विच आर मेंशन्ड इन अवर संहिताज, जो 4000 से अधिक साल पुरानी है, चरक है, सुश्रुत है. तो ये पहले से टेस्टेड, प्रूवन टेस्टेड मेडिसिन को फिर से WHO से सर्टिफिकेशन लेना या IMA से सर्टिफिकेशन लेना, मुझे नहीं लगता कि देयर इज एनी नीड. लेकिन आज की इस तरह की माहौल है, तो बाबा जी ने 280 पेशेंट पे स्टडी किया, आपको दिखाने के लिए कुछ पेपर तैयार किए, देखो भैया हमने दिया, लोगों को फायदा हुआ. तो इज इंट्रोड्यूसिंग दैट वे.
आप कोरोनिल लेंगे सर परमेश्वर जी?
अरे 100% मैं कोरोनिल. लिसन
1 minute डॉक्टर जयलाल, 1 minute, आई एम आस्किंग हिम अ क्वेश्चन.
यस, सी कोरोनिल मैं इसलिए लूंगा क्योंकि इसमें गिलोय है, अश्वगंधा है, तुलसी है. और आई एम बीइंग आयुर्वेदिक प्रैक्टिशनर, आई एम प्रैक्टिसिंग फॉर अबाउट 20 years एंड आई एम सीइंग ऑलमोस्ट 100 पेशेंट एवरी डे. आई एम ए प्योर आयुर्वेदिक प्रैक्टिशनर. मैं बुखार उतारता हूं अपनी आयुर्वेदिक मेडिसिन से, मैं किसी के डायरिया को ठीक करता हूं अपनी आयुर्वेदिक मेडिसिन से, मैं ट्यूबरक्लोसिस ठीक करता हूं अपनी आयुर्वेदिक मेडिसिन से. सो आई हैव मच कॉन्फिडेंस दैट बाय टेकिंग गिलोय, अश्वगंधा एंड तुलसी यू आर डेफिनेटली गोइंग टू बी बेनिफिटेड इन एनी सिनेरियो. ये जो वैक्सीन है, ये हो सकता है कि कामयाब ना हो.
Dr. Jayalal, go ahead.
That is an evidence-based medicine. We welcome that. We are not saying that. It was promoted as a first evidence-based medicine. That was a statement which was put. But what is the evidence? Who has done the study? Patanjali himself has done the study. He is the producer of the drug. One of the person who did the study was himself, and he is proclaiming that drug is effective. There is hardly 45 people and asymptomatic COVID people. They did a study and they are coming out as saying that this is it. And very pathetic, painful to note. It mentioned in that article, it is a pilot study. What is pilot study? Before doing any study, we do a sample study. That cannot be a result. Pilot study only helps you to take a decision. Yes, you can proceed with the study. But once at the pilot study,
बरखा जी, आप घर पे चावल बनाते हैं, खिचड़ी बनाते हैं. You just take एक दाना of चावल and check it. And if you see चावल गल गया है, तो that means पूरे चावल गल चुके हैं.
I think the point is, let me come in. Dr. Jayalal, let's clarify some things. You are not opposing Ayurveda, correct, Dr. Jayalal? You are not opposing Ayurveda.
Absolutely no.
You are not bothered about the WHO certification, correct?
No, I told you I am not bothered. You come and say the sun is rising as west, because I know for sure sun is rising only in the east. Similarly, someone says WHO certification. I know for 100% sure WHO will not give a certificate. And why should we say that WHO? I will not be carried away by that. That is what I am saying. I am not saying.
Why did you call it in the beginning of this program a secret drug? You used the word secret drug. What did you mean?
That is a definition for what we use. It is as per our code of ethics. When we do not know the components of the drugs, when we do not know how it is working, and then we call it a secret medicine. But by experience, we say this drug will work. Tulasi will work. Ashwagandha will work. We are not denying that. But as far as the modern medicine, it has to be the chemical component has to be studied, and how it is working and what level it is working has to be understood. That is the difference between the principles of Ayurveda and principles of modern medicine.
Okay, so Rajeev,
they are, Barkha ji, they are not understanding how Ashwagandha is working as per their parameter. But if we talk about Ayurvedic explanation, we have good explanation how Tulsi is going to help, how Ashwagandha is going to help, how Giloy is going to help. So basically, it is not like, ये बहुत अच्छी बात नहीं है कि अगर आपके पैरामीटर पे मैं किसी चीज को प्रूव ना कर सकूं, तो that means मेरी चीज ठीक नहीं है.
Okay, there are
only one point. The secret means it is not that not effective. I am not saying just say secret, it is not effective. Secret means it is not disclosed. It is not well known. It is not displayed.
It is Tulsi known to every person, even in the villages, every house. They know Tulsi, they know Giloy, they know Ashwagandha. It is not a secret drug.
Can you tell me, this is the Coronil immunity booster. Rajeev, is the objection the ethical conflict of interest in the presence of the ministers, in which case there's an interesting point raised by Parmeshwar that we're also boosting two vaccine manufacturers who are from the private sector, right? Or is the problem that we don't know enough about what goes into this particular product? I'm a bit confused. Which is the objection, Rajeev?
Well, the objection that I see here is Ayurveda and modern medicine are completely different systems of medicine. They both aim at the well-being of humans, but they believe in different principles. So here's a word, I'll repeat the word belief. Belief is a very powerful phenomenon. And all over the world, people believe in different things. So you see, Dr. Arora believes that these medicines work. That's based on his experience and his training. I'm not an expert in Ayurveda, so I cannot say that these things do not work or do work. I'll just trust the words of experts like Dr. Arora, who are qualified practitioners in that genre of healthcare. My genre of healthcare.
He's picked up two fat books for you. What are the books, sir? Parmeshwar ji, कौन सा किताब है? उसमें क्या लिखा है?
ये चरक संहिता है. ये चरक संहिता. ये आपकी डेविडसन से पतली नहीं है. और इसमें जो लिखा गया है ये इतना डेप्थफुल है कि अभी सी बरखा जी मैं तो ये बोलता हूं वी आर कैरिंग वेट्स इन किलोग्राम्स एंड दिस साइंस इज इन मिलीग्राम्स एंड हम तोल नहीं पा रहे हैं. ये बोल रहे हैं कि चेक अभी हमें इसको चेक करने की क्षमता ही नहीं है. इसको चेक करने की क्षमता हमें नहीं है. ये किताबें हैं.
मेरे पास कुछ सवाल है आपके लिए लेकिन I'll let Rajeev complete his point. Rajeev, yes.
Okay. So all over the world, this virus is affecting people all over the world. And worldwide, the way you approach whatever treatment for this virus is the same. It is not the proprietary.
He is going to show you his entire bookshelf today.
Very okay. Nice. Excellent. Very good. Very good. So, very good, Dr. Arora. I'm really enjoying this. Okay. So, all over the world, the way it doesn't matter. Even in modern medicine, what we call modern medicine, we use a lot of herbal medicines. For example, digoxin, where did it come from? Heart failure, it came from a plant, and so on. Malaria, how do you treat malaria? All right. So, all these things came from plants. Yeah. But the point here is, if you want to prove, at least in this system of medicine that I'm trained in, which is basically the worldwide system of medicine that is practiced in most Western nations and developed nations, the way they approach a drug is they have to be put through a certain series of tests. So first there has to be a biological plausibility. First, you have to make sure that it actually works. So Dr. Arora has correctly said that he believes that this has an antiviral property. So let's call that a biological plausibility. Biological plausibility is like, you can't say chalk powder works against a virus because you'll never test chalk powder in a trial. But Dr. Arora says it's working, so they put it through a trial. The next step is you have to put it through animal studies just to make sure that this particular combination is working in animals, and also in lab studies where there are virus-infected cells and they test out the agent and see how the virus proliferates in the cells with the agent and without the agent. And then they test it in volunteers. And once it is successful in volunteers and it's considered safe, then it's put through a clinical trial. And these clinical trials are first in small numbers and then in very large numbers.
And now let's bring it down to how this applies to this product, Rajeev. In brief, what has been the lapse according to you?
Well, at this point, we are at the very beginning of evidence-based medicine for this particular medicine. And this product was tested in 45 volunteers who had, you can't call them volunteers, they had asymptomatic, very mild, very young, healthy people who had been PCR positive, and they tested a group of 50 people with a placebo, which is I'm impressed by how much went into conducting that trial. They observed these people over a period of time and collected all their parameters. Again, hats off to the people who conducted the study. But the way the study has been analyzed, I have serious objections to their methodology. For one thing, the outcome that they measure, it is called RT-PCR on day 3 and day 7. Basically, in plain English, it says, how long has the virus stayed in the human body? Now, the problem is we don't have day 0 listed. So we only have the ending of a story. We don't know when the virus started.
So your problem is neither, Rajeev, with the presence of the ministers, nor with the allopathy itself, nor with the civilizational value of tulsi and other natural ingredients, but the way the research has been conducted and placed in the public domain, right?
Absolutely. My position is I look at research around the world and every day I tweet on dozens of papers.
Parmeshwar ji respond. Okay, but Parmeshwar ji, go ahead.
देखिए हमें ना बहुत आराम से समझना होगा कि दो डिफरेंट स्ट्रीम्स की हम बातें कर रहे हैं। हम आयुर्वेद की बात कर रहे हैं, हम एलोपैथ की बात कर रहे हैं, एंड दोनों ही स्ट्रीम्स को कंट्रोल करना, वहां पे क्वालिटी एश्योरेंस देना, दैट इज द जॉब ऑफ द गवर्नमेंट। एंड मुझे ये बताइए कि अगर गवर्नमेंट हमारा एक आयुष मिनिस्ट्री बना करके दे हैव सेट ए प्रोटोकॉल कि आप इस तरह से इस ड्रग को आप ट्रायल कीजिए, एंड आफ्टर दैट ट्रायल दे रिलीज ए सर्टिफिकेशन, एंड उन्होंने दिया आयुष ने, तो इसमें आईएमए को क्या प्रॉब्लम है? वाई दे कम इन बिटवीन? उनको इस ड्रग की एफिकेसी की चिंता है, या सोसाइटी की जनरल चिंता है, या अपनी मार्केट छिन जाने की चिंता है? मतलब मैं तो ये पूछना चाहता हूं कि क्या प्रॉब्लम है आईएमए? आप ये बताइए कि आईएमए इज ऑल्सो अंडर गवर्नमेंट। वो आईएमए ये क्वेश्चन क्यों उठाता है जब गवर्नमेंट जो है उसका एक आयुष मंत्रालय है, वो देखने के लिए है कि क्या चीज गलत है, क्या चीज सही है, उसका अपना एक प्रोटोकॉल है, एंड उसमें भी दो तरह की मेडिसिन है। सी, अगर अगर मैं कोई फॉर्मुलेशन जो मेरे इस अष्टांग संग्रह में मेंशन है, अगर मैं गवर्नमेंट को देता हूं कि आई वांट टू मेक दिस मेडिसिन, वो विदाउट क्लिनिकल टेस्टिंग मुझे अलाउ करते हैं, ये मान करके कि ये ऑलरेडी प्रूवन मेडिसिन हैं। सी, everything which has been written in Charak, Sushruta and Bhagavad has been accepted as proven medicine by the government of India.
I think you raise a fair point, and let me actually put that to Dr. Jayalal. And I think Dr. Parmeshwar raises a fair point that the process of approval from both the drug authorities and the Ministry of Ayush has been followed, right, Parmeshwar ji? That's what you're saying,
जी,
correct?
बिल्कुल,
So,
yes.
So IMA को क्या तकलीफ है? What is the problem that the IMA has then, Dr. Jayalal?
Yeah, you said why we are raising the issue. We are not raising the issue.
Why are you raising the issue if the certification has been obtained per protocol and procedure from the Ministry of Ayush and the drug controller?
No, why we are saying that this issue when it was progressed is the first evidence-based medicine. The word so far in Ayurveda used is an experience-based medicine, and based on their Vedas, that is based on the Charak, what has been written, that has been fully believed. Now, first time they are coming and using a modern medical terminology, there is evidence-based medicine. What evidence they have done is absolutely, it is not in any scientific standard of this value they have done. Secondly, as you have rightly asked, why we are objecting? We are objecting because it is released by the Honorable Health Minister, and nowhere in the board it was said it is an Ayush department is giving that drug. If it is an Ayush is saying, Ayush Minister is coming and saying it is an Ayush drug we are promoting, we have no objection for that. And it is there within their limit. When it is come as a common way promoting a drug which is going to say it is going to be a prevention, treatment, and even the post-COVID complication, that is cheating the public. That is, you are giving a wrong message to the public. That the person will consider that by taking a coronal, symptoms can be cured.
Okay, I want to understand something practical, Parmeshwar ji. While COVID, a patient is being treated, और जहां तक मुझे समझ आया, the research that Patanjali has been done on asymptomatic COVID patients, right? Not actually on symptomatic ones. So, are you saying that as a doctor, you would give these immunity boosters? You would give them along with something, na? सिर्फ आप अकेले तो नहीं देंगे?
Along with something, yes, for sure. मैं एज ए इम्यूनिटी बूस्टर इस कोरोनिल को एक्सेप्ट कर रहा हूं. मैं इसको कंप्लीट ट्रीटमेंट फॉर कोरोना नहीं बोल रहा हूं.
It was said in the meeting, sir. It was said in the meeting. You were here.
It is preventive for sure. It boosts the immunity. It is antiviral also. But Tulsi 50 mg, I think, is lesser. If I am going to treat a COVID patient by Ayurvedic medicine, so I have to add some different medicine also so that I can give the complete coverage. So I am saying that Coronil as preventive medicine can be recommended. Coronil as to avoid the post-COVID complications can be recommended. But as a physician, I am not totally agree that this Coronil tablet will be a complete set of treatment to the COVID patient.
Okay, Rajeev.
This kind of scientific facts we need to know. That is what we are recommending.
I have to take last comments now. Rajeev, I'll start with you. What do you think the health minister should be saying or doing to sunlight is the best disinfectant? I think we need a very clear, scientific, non-emotional statement from the government. This is what Coronil's ingredients are. These are the circumstances in which you can take it. And please do not confuse it as treatment for COVID. I think this is something that is needed to be specified. Rajeev, I'll start with you. What should happen now?
Well, if you ask me, my opinion is this is being there are so many supplements that are health supplements used all around the world, and they're
Yes.
not exactly evidence-based. All right. In fact, this is a multi-billion-dollar industry all around the world. You're aware of that. In fact, more medicines are sold as nutraceuticals than by modern medicines. So that's fine. It may be marketed, if required, it may be marketed as a supplement, but you cannot say it prevents, treats, or even post-treats the complications of COVID-19, because without proof, you cannot make a statement. And this is a
Okay.
new virus. This virus did not exist long time ago when these things were written. So we need to have proof. There is no need to disbelieve anyone, but it's always good to have proof before you go ahead in an uncertain situation.
So what would you like to see the government doing at this point?
We need let them do a very large, neutral, large randomized controlled trial of, it will need at least several hundreds of patients in each arm, and it's going to be difficult because you can't deny people treatment in other modes. For example, in this particular trial, according to the paper at least, other treatments were not given to these people. Now we are about to vaccinate the general public, and when you vaccinate the general public, it will be very difficult to dissect out the benefit of the vaccine versus the
Okay.
purported
Parmeshwar
of
ji.
a supplement.
बरखा जी, वैक्सीन भी तब काम करती है when your immunity levels are good. When you are immunocompromised, if you take vaccine, then it will not work. Immunity should be there in all the condition, even if you take the vaccine. You see, please, थोड़ा समय होता है, शायद ऊपर के डॉक्टर आईएमए के वो ये बात बोलेंगे नहीं, लेकिन उनकी किताबें अगर आप पढ़ेंगे तो उसमें लिखा है वैक्सीन कब फेल होती है, जब इम्यूनिटी लेवल डाउन हो. तो इसलिए हमें इस समय कोरोनिल को भी बल्क में गवर्नमेंट को खरीदना चाहिए, एंड इट शुड बी डिस्ट्रीब्यूटेड all around the country. Number one. Number two,
Do you believe ethical protocols were followed, Parmeshwar ji? Did you believe
100%, 100% protocols were followed.
The sample size is not too small?
Not too small.
On
See,
asymptomatic COVID
again,
patients?
Barkha ji, please try to understand. हम डेक्सामिथेसोन स्टेरॉइड, मिथोट्रेक्सेट जैसी मेडिसिन को तुलसी अश्वगंधा से कंपेयर नहीं कर सकते. अगर आपको तुलसी लेनी है तो आप डॉक्टर का प्रेस्क्रिप्शन नहीं लेते, बट डेक्सामिथेसोन लेना है तो यू डेफिनेटली सीक ए प्रेस्क्रिप्शन फ्रॉम द डॉक्टर. So हमें थोड़ा सा, because this is a pandemic time, this is different scenario than normal. That's why health minister is coming and saying कि if with vaccination, if you take Coronil, that will add into your. And second, why health minister is coming? Health minister तो दोनों का है ना. आप डॉक्टर हर्षवर्धन को एज ए डॉक्टर मत लीजिए, एज ए मिनिस्टर लीजिए प्लीज. अभी क्या है कि वो एलोपैथ को भी प्रमोट कर रहे हैं, एंड वैक्सीन इज ऑल्सो नॉट अ ट्रीटमेंट फॉर कोविड, दैट इज ऑल्सो फॉर प्रिवेंशन, एंड दैट इज नॉट 100%, दैट इज ऑल्सो 80%, 90%, एंड कितने समय तक एफिकेशियस रहेगी ये भी नहीं पता. तो फिर भी उसको प्रमोट किया जा रहा है, बिकॉज कहीं ना कहीं से एक रे ऑफ होप नजर आ रही है.
तो जो दिखता है कि काम करता है उसको पकड़ लीजिए एट दिस पॉइंट. डॉक्टर जयलाल, I'll give you the last word.
Because we are in a pandemic. We are in a pandemic. It's a different scenario.
Dr. Parmeshwar Arora says that you're in a pandemic. Vaccines are being promoted, which previously would not have been. Therefore, immunity boosters are being promoted. What does the Indian Medical Association plan to do now? You've issued a very strong statement. What do you plan to do now?
No, we want a clarification from the Honorable Health Minister, come out and say, accept that this is only a preventive immunobooster. Then we have no objection on that. When he comes and says that it is a curative drug, I am promoting that drug, that is definitely against the medical ethics. And on the WHO certification, we know it is a blatant lie which has been put for an economical reason, but we do not consider that is an important at this moment, because the much more than that what the statement of the Honorable Minister and the Ramdev ji, that medical practitioners, the medical terrorists, is much more worse than the blatant lie which they were exposed. So we would like only request the learned leader. I am so happy that Sir has very openly said this is only a immunobooster, it is not a good drug for treatment, and he has some other way. This kind of research should be promoted. This should become, the government should come out with the clarification that we are only promoting a preventive, one of the immunobooster or the supplement drug, not as a curative drug. Then the question will be solved much more.
Okay, so you would like to hear from the Health Minister on that. We'll leave it there. Dr. Parmeshwar Arora, Dr. Jayalal, and Rajeev Jayadevan, thank you so much. I think this is a subject on which the jury is out. As Rajeev said, every day there are any number of self-medicated things that people are choosing to use, ranging from vitamin D to vitamin B to Coronil to Tulsi, or you could be like me and have none of it. The choice is yours, but I think when it comes to the government, you need an official clarification on the role and the limitations both of this product. And I think that is something that we all agree on. Thank you so much, doctors, and to our audience, see you tomorrow now. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.